Performance-enhancing drugs in the sports industry. I'll be talking about how they affect an athlete's health, an athlete's performance, and an athlete's reputation in the industry. Performance-enhancing drugs are changing the game, every game. They remain a hot debate topic among anyone from sports broadcasting all the way to couch potato sports fanatics, and they have been affecting the sports industry for many years. The effects of doping can be extremely harmful to both an athlete's body and their reputation, but that doesn't stop athletes from using these drugs to boost their performance. Jim Sensenbrenner, a member of the House of Representatives, was quoted saying, "These days, the temptation to use steroids in sports has become too great for many young athletes. This is despite the fact that many organizations have implemented stricter PED policies." Performance-enhancing drugs have affected the sports industry in a variety of different ways, both positively and negatively, including impacting an athlete's health, the athlete's performance, and the athlete's reputation in the industry. The effects on an athlete's health that are using PEDs have had a huge impact in the industry. The use of drugs can even be deadly. In an article from 2009 titled "Cycling: Inside the Sport History" from the National Broadcasting Corporation, in 1960, the Summer Olympics, Knut Jensen died while participating in the 100-kilometer cyclist race. His biopsy revealed that he was in fact on Ronicol, which is a PED. There are multiple substances and methods that are considered PEDs to the US ADA, which is also known as the United States Anti-Doping Agency. According to the US ADA's article called "The Effects of PEDs," which was updated in 2014, anabolic agents are used to treat late puberty in adolescence, some forms of impotence, and wasting of the body caused by some infections. The abuse of these drugs may result in liver damage, stunted growth in adolescence, increased aggressiveness, and sexual craving, which is also known as roid rage, and is also known to be linked to depression. Stimulants are medically used to treat ADD, ADHD, narcolepsy, asthma, and obesity. When stimulants are misused, they have negative effects on normal functions such as increased heart rate, increased blood pressure, and an increased risk for strokes and heart attacks. There are multiple different growth factors and hormones, but the most commonly abused are HGH, insulin, EPO, HCG, and ACTH. Each substance is responsible for causing different psychological problems. HGH and EPO are responsible for causing hypertension and blood cancers, while HGH causes thyroid problems, loss of vision, high blood pressure, heart failure, and many others. EPO also causes stroke and pulmonary embolism. Blood doping is another problematic method of substance abuse with three main methods: EPO, synthetic oxygen carriers, and blood transfusions. When blood doping is used, the person has an increased red cell body mass in order to increase their muscle mass. This can result in an increased amount of stress on the heart and may lead to blood clotting and strokes. Despite the many risks of using PEDs, the benefits outweigh these risks in many people's eyes. The assorted amount of illegal drugs that athletes take are constructed to boost their performance. Jose Canseco, a former MLB outfielder, commented on the use of PEDs in sports and said, "For certain individuals, I truly believe, because I've experimented with it for so many years, that it can make an average athlete a super athlete. It can make a super athlete incredible, just legendary." According to the Join Together staff in Partnership for Drug-Free Kids, which was updated in 2014, steroids, for example, boost testosterone, allowing for an athlete to gain muscle mass much quicker, and also allows for an athlete to train harder by reducing the damage to muscles that occurs during training. A 2015 article from the School of Professional Studies called "Why Do Athletes Risk Using Performance-Enhancing Drugs?" It was presented that the NFL, 60% of all steroid suspensions involve linemen. Steroids help give an athlete an aggressive edge, endurance, speed, and strength, and this may be the reason behind it. Athletes are not just athletes. They're heroes to people and millions of people around the world. The fact that PEDs have such extreme benefits when it comes to performance, this may be the reason why so many athletes take these PEDs. Improvements to an athlete's skill level can result in a substantial amount more money to an athlete's contract. With a whole new set of skills caused by PEDs, an athlete is bound to attract a lot of attention from fans. Although, if an athlete is caught doping, it may send the wrong message to these people that look up to him, thinking that it is okay. People may think that because their favorite athlete did it, they can do it too, but they can't because it is illegal and it's wrong. The industry of sports have been affected by PEDs for centuries, by impacting the athlete's health, their performance, and their reputation in the industry. The benefits of using PEDs can literally change an athlete's career around, from being a nobody to having their name on thousands of fans' jerseys on their back. That is, if they aren't caught. With leagues continuously implementing stricter drug policies, it is becoming harder and harder for people to get away with using PEDs in sports. Although performance-enhancing drugs can make an athlete a super athlete, is it really worth ruining your health? How about ruining your life?